Hey, Ash here from All Things Dentistry, the place where we're passionate about sharing those unwritten hints and tips of dentistry. A viewer, subscriber was asking me this really great question, and it was, how do you practice indirect vision? Well, I've been thinking about this actually for the last 6 months, and I think I've got a simple solution you can do at home. Okay, so all you need are your loupes and, not a dad joke calendar, but some straight lines, a circle, a mirror, or even just a regular mirror. It doesn't matter what it is. And let's go ahead and take a look. Now, I want to shout out to ATeeth. They sent me these prototype loupes many years ago, and I've been using them here and there. They're great. And, most of the movements we do in dentistry are, especially with mirrors, are just, front to back. So buccolingual, or let's say buccolingual, mesiodistal, and maybe a circle once in a while. And there's other movements, but at the basics, what I'm thinking you can try doing is literally just with a pen, falling back and forth. So you can't see to my mirror. Let's go ahead and do this. Let's see if you can see to my mirror. Hopefully you can. Literally mimicking kind of how the patient sits. As the patient is sitting, their maxilla is kind of perpendicular to the floor. And then I'm just going to use my mirror, as you can see there. There we go. So let's do it like this. And literally just trace it. And it's not doing the whole alphabet because I tried to draw backwards, and I'm just going to draw straight up and down. And, just even a minute a day for, say, a week or something like that might actually be helpful. So just going back and forth. I know I might get judged because I'm going all over the place here. And, one of the things you may want to do, I was thinking about this because you may want to go light, or you may want to make a groove just to make it a little bit easier when you're starting. So you can just track. So you see how I'm making a little bit of groove in the calendar here. You don't need a dad joke calendar. I recommend you don't have one, but this is what I get given one of these every year, and we tell these jokes in the morning at our morning meetings. So giving a groove, you can use a piece of wood or something like that, but this is just simple. So I'm just tracking this back and forth, getting my brain to practice going back and forth. So up and down, back and forth, and then, oh gosh, the circle. So let's try to get the circle here. So just doing a circle, obviously it's going to go all over the place. I did try to spell my name. It did not work very well. So those are the basic things. If you're going to practice, do that a couple minutes a day just for, say, a week or a month. It might really help, especially if you're in dental school. And one of the other things, then you can really kind of go at it and start doing all the letters on whatever document you want. So those are more straight lines and whatnot. So just back and forth, and just kind of, so rather than trying to do it at school or at work, you're going to drill out whatnot, it's just something you do just to practice that hand-eye maneuver. Now the next one, I want to see if you're starting to use a microscope. It's actually the reverse, so it's actually more complicated. I should have done this. It took me a really long time because now we're doing the mandible, and I'm actually going backwards in reverse. So I'm not looking straight down. I'm trying not to. It's actually kind of like this, if you may. So this was actually really tough to do. If you can see it there. Oh yeah, you can see it. This was really tough to do, looking in the mirror and then going back and forth. So pretend, if this is our mandibular molar, and these are those are the mesiocanals, and you can't, when you're using a microscope, it's hard to see direct vision into those, so you have to do indirect vision. Wow, that took a long time for me to be able to do this and do this. And then the movements, like I said, were back and forth, and then kind of like this. Anyways, I'm so grateful you're here. Let me know if that helps. Anything, because that's a big movement in dentistry, is using a mirror. Anyways, I'm so grateful you're here, and we'll talk to you soon. Cheers. Hey, Ash here, and I wanted to take a second of your time just to introduce our course, Root Canal Like an Endodontist. We've had it for a couple years, and we've had some amazing successes through it. Just confidence building on behalf of our students. And really what happened was, a few years ago, I wanted to create a course to help others because I know what it's like on your endo journey. A lot of times you don't know what's going on. You don't know if you've ledged it. You don't know what to do if you blocked it. You don't even know if a curved canal, what to do. And what I wanted to do was take all my mistakes and my training from my residency and put it into a affordable online course for everyone around the world to join in. And it's been absolutely amazing. And I wanted to offer to you, check us out at allthingsendo.ca. Once you join the course, you get access into our private Facebook group where all of us answer questions. And I'm telling you, there are questions every day that you might be able to, I'm sure you'll be able to connect with, because sometimes it just takes a little bit of courage to ask a question and then your outcome may be incredible. Anyways, I look forward to seeing you there.
allthingsendo.ca. We'll talk to you soon.